Okay. Ready.
Whoa, I saw socks.
This is crazy. Hello, welcome back to the channel. My name's Ed, your friendly neighborhood doctor, and it's been too long since we checked out House, which was probably my favorite TV show before I studied medicine, and I've forgotten most of the episodes, so I asked you what you'd think I should check out, and you recommended season 4 episode 11 called Frozen. So let's see what it's all about. Yeah, that is not great. A low velocity penetrating trauma to the right anterior thigh. The blood is spurting out here, so we're dealing with an arterial rupture because the blood's under much higher pressure than in the veins. Given the location of the injury, we're likely dealing with a femoral artery rupture. Blood flow down the femoral artery is around 1 litre per minute, and you could lose around 2 litres of your 5 litres of blood before you're a goner. So without any intervention, this chap has only a couple minutes to live. Given the fact he's in the tundra with seemingly no one around and no tourniquet to slap on it, I think this is a big challenge, even for House.
Bleeding! Stop bleeding!
Oh. That's because your blood's freezing as it's hitting the air! Here!
Wow, interesting. Okay, so the cold weather has actually helped here to stop the bleeding. Although Arctic survival medicine is a bit outside my area of expertise, given the fact I'm in the UK and I mainly deal with soggy weather. This at least makes sense from a basic medical science point of view. Worth noting though, the blood isn't clotting, it is freezing. Blood clotting is an active process that turns your blood from a liquid to a solid, and so requires enzymes that only work within a particular range. However, when you get below zero, clotting kind of becomes irrelevant because your blood is going to actually freeze, and that's what we're seeing here, and that's what's apparently slowing the bleeding. It still feels unrealistic for me that an artery deep within the muscle that has blood coming from it, that the blood's actually going to freeze close enough to the artery to actually stop the bleeding. But hey, I'm no expert, and you know, it's a drama. So either way, it's all good fun. I mean, I say fun, it's pretty bleak for this guy.
Blood pressure on it!
I feel like it's frozen!
That's the least of your problems! The blade severed your femoral artery!
Cool, yeah. So the medic here is also thinking it's coming from the femoral artery. And yeah, pressure on the area is great, but a tourniquet is really what's going to save his life. It looks like she's kind of wrapping something round here that's kind of like a tourniquet, but that is nowhere near on tight enough. The mantra of a tourniquet being, if the patient isn't screaming, it's probably not on tight enough.
You're gonna put that in me?
Glue's the best way to repair your artery at this temperature.
Okay, it does surprise me that glue would be so effective here. Again, no Arctic survival expert, but it does surprise me. We use glue a lot in the emergency department, but it's always, in that scenario, applied topically, so on top of a wound to help close it up. We never just spray it inside of a patient. There are specialist adhesives that are non-toxic that can be used in surgery, but realistically in this scenario, you'd want to explore the injury and clamp the artery proximal to the bleed. Then you'd have a couple of hours to actually repair the artery properly before the leg is going to die. So you need to restore that blood supply to have a definitive treatment.
Blood flow looks good.
Yeah, excellent. Checking the distal supply to the foot. I like that a lot. Once the bleeding is controlled, that's the next priority. You saved the life, now you want to save the limb. And although she's done a freaking great job stopping the bleeding, he's certainly not out the woods yet. So he'd likely need an operation to mend that artery properly to restore the blood supply to the leg. Explore the wound too to make sure there's no other debris, clean it out, and then eventually stitch him up. Realistically, he's not going to have that operation here, so you'd want to just maybe clean it out, cover the wound, and get him transferred out as soon as possible.
Okay! Kate, are you okay? Are you okay? Hey!
Oof, so, the old patient switcheroo. I did not see that coming. What's worse than one isolated patient? 2 of them.
The budget committee voted to charge for cable in the patient rooms.
Slippery slope. Today we withhold porn, tomorrow it's clean bandages.
Talk to Carlson.
Yeah, this is the same as the NHS. Most hospital beds have this kind of mechanical arm with this media centre that patients have to pay for to get any kind of entertainment, although, you know, it doesn't have porn. At least I don't think you can get porn. When I worked on the ward as a doctor, I'd frequently have to show patients how to use it, like I was some kind of representative or customer support for this company that was making money out of charging people to watch TV in hospitals.
Could be appendicitis or a gallstone.
Or a kidney stone.
That wouldn't be any fun.
So they are naming causes of abdominal pain and vomiting. That's the likely main complaint. Appendicitis, unlikely, as before it ruptures. So before you have severe pain, you get several hours of progressive pain. The gallstone pain can be fairly quick onset, but it does tend to build over minutes and comes on with food. Out of all these first differentials, kidney stone is the most likely. It can come on very suddenly and it's very severe. People often doubled over in pain with it.
Could be a struvite kidney stone.
Most kidney stones are calcium and benign. Why would you suspect a struvite stone?
Because he said kidney stones were boring.
This is all a little bit mad. Very much TV show medicine. Listing out a bunch of broad differentials like this, there's some truth in that, but really you want to get more of a history to know what's going on. And picking your primary diagnosis based on what you think is cool, that's not going to work out so well for you in the long run. Just because you think something's cool, it doesn't mean your patient is more likely to have it. And their primary diagnosis is a struvite stone. So this is where you have a specific type of bacterial infection in the urinary tract. And the waste product of this bacteria is struvite, which rapidly forms stones, which can block up the ureters. Any kind of ureteric stone with infection is a bad sign, as the urine can be obstructed, meaning the infection can just build up and can lead to permanent kidney damage and even sepsis and death.
If it's a struvite stone, she needs to break it up quickly before the infection shuts down her kidneys.
This is where it gets fun. These are the supplies and medications she has available.
Cool. So we got like an Apollo 13 style situation where we have to cobble together treatment from a box of stuff. The difficulty is ureteric stones are commonly removed by an instrument with a camera inserted up your bits, so I wouldn't really want a homemade one of them put up me. I mean, it's bad enough to have the actual thing that's designed to go up you. And let's not forget, what's even more mental is they've got no evidence of this actual diagnosis. They have just gone with it because they think it's cool.
What else do they have down there?
I just said.
I don't mean medical stuff, other stuff. Some geological equipment breaks ice and rock the same way we break kidney stones.
I think we are clutching at straws a little bit here. What no doubt he's talking about is lithotripsy. That's where we use highly focused ultrasound waves to break up stones into smaller stones so that they can be passed out more easily. Essentially breaking up rocks into smaller rocks, and I think that's the geology connection here. But using an industrial ultrasound for a diagnosis you just think's cool instead of actual medical equipment, I mean, it's all sounding a little bit risky. Well, I think we can say we saw that coming. Yeah, blasting someone with some ultrasound that is not designed to be used in a medical setting, that it has to be so focused to break up the stone and not damage the tissue around it.
Dr. Milton, are you able to run a Chem 7?
Yes?
Well, that'll tell us if her kidney function is declining.
What? So they actually have access to blood tests. Why haven't they done them yet? They were considering blasting her with an industrial ultrasound before doing any kind of blood tests. This is a bit rogue.
But your kidney function is declining. Sounds like a kidney stone to me.
The decreased function could be from dehydration caused by vomiting due to a gallstone.
Yeah. Okay. This totally checks out. Renal function can go off for various reasons. We categorize them as pre-renal, renal, and post-renal. Pre-renal causes would be things like dehydration, not having enough fluid in the body to drive the filter process within the kidneys. Renal causes an issue with the kidney itself, such as an inflammatory condition or a drug affecting them. And post-renal would be something like a stone, so an obstruction to the ureter that's causing urine to back up into the kidney. And on a blood test, all of these are just going to look like renal failure. It doesn't really give you an indication of what the actual cause is.
You agreed that the Chem 7 would decide if it was a struvite stone.
I agreed to do the test. The results are up for interpretation. I'll redo the test in an hour.
Right, before I was a doctor, I probably would have thought that this was, fairly logical way they are approaching things, but it's really not. Going to medical school, you appreciate how much of a diagnosis is in the history and the physical examination. Okay, it's going to be harder to do the examination in this case, but at least she is actually a doctor, so you should be able to palpate for where pain is or if there's any masses to help you rule stuff in or out. Just doing the odd blood test here is far too focused at this stage. You need to use the history to hone in on what you're actually dealing with. And for abdo pain, you want a full range of blood tests, like a full blood count, a liver function test, amylase, your urea and electrolytes. You'd want your clotting, your bone profile, and a VBG as well to get a baseline, as well as to help you figure out exactly how all these things are functioning.
My chest hurts.
It's deviating to the left.
His right lung is collapsing.
Kate,
Well, I didn't expect that. There may well be a lung collapse going on here, but actually what you should really be mentioning is that it's a tension pneumothorax. This is a medical emergency and can kill you within seconds to minutes. And it's showing up here as tracheal deviation, where your windpipe goes to one side, meaning something's either pushing it over there or something's pulling it from the other side. In the case of a tension pneumothorax, air is being sucked in between the lung and the chest wall. And as more and more air gets sucked in, it ends up pushing the trachea away. So with every breath she takes, more and more air gets drawn in and starts squashing your lungs and your heart, and that's how it kills you. It's essentially a big balloon that keeps expanding into your chest.
Okay, now pull out the plunger. I want you to stab yourself in your right side between the second and third rib in the mid-clavicular line.
Excellent. So this is the exact right treatment for a tension pneumothorax, and they've diagnosed it and treated it super quickly. So fair play. This is what we call a needle decompression, where we use a big needle in the second intercostal space in the mid-clavicular line, so in the middle of your clavicle. This essentially allows all the air that is building out to escape, essentially popping that balloon and stopping it from expanding. This is just a temporary solution because it's obviously going to create problems down the line, as you're now going to have a simple pneumothorax, so air can freely move between the outside and your thoracic cavity, but at least it stops the initial medical emergency. More recently though, guidelines have changed where we put the needle in a slightly different position. Now it's in the fifth intercostal space in the mid-axillary line, so in the middle of the armpit. And this is the position where you'd want the definitive treatment, so actually where you'd put a tube in and a chest drain to help inflate the lung over a bit of time.
By the time we get someone else there, you'll have suffocated. Just do it.
What? Why? Why would you do it like that? Why has she used so much force there? It's gonna make it extremely inaccurate if you stab yourself like that. It's lucky she's gone in the right place. You just place the needle against the skin and push it in. It needs to have a good amount of force, but it needs to be quick and controlled. Stabbing yourself like this, I mean, it could have gone anywhere. Although, having said that, it's house, and so miraculously, it's done the trick. So now we have a new symptom. We have abdominal pain and a tension pneumothorax. I don't think you'll find this in the medical textbooks. That's a real interesting combination and a bit of a head scratcher. Really, the causes of a tension pneumothorax are going to be chest trauma or barotrauma, so if she's been using breathing apparatus, or an underlying lung disease. They very rarely happen with any other causes, really, although they can be spontaneous, and never say never in medicine. Things could just happen in strange ways. We are strange creatures.
Since the only imaging equipment you have is X-ray, let's start there. X-ray your entire body.
Sorry, is this a joke? We are going to get some X-rays to see what's going on. If they had an X-ray machine, why didn't they use it to look for stones when they were thinking that's what was going on? You know, House is supposed to be like the smartest person on the planet, but in reality, trust me, you would not want him or his team anywhere near you. This is why we love House, right? It's about the mystery and the drama, and you can watch videos like mine to figure out it's okay. We would never treat you actually like this. Also, it seems like the wound from her needle thoracostomy has miraculously disappeared, so we can forget about the pneumothorax now, even though she would need a chest drain inserted. But hey, we'll let that one slide.
I can do the physical. There's no reason you need to watch.
I can think of at least 3 reasons. One of them's medical.
So only now do we do the physical examination. I'm not mad. I'm just I'm just disappointed. I mean, what other vital pieces of medical assessment are they sort of hanging back in reserve? Are they sort of waiting for her to collapse before they ask her about her past medical history and what meds she takes?
How long does it take you to get naked?
It's the South Pole. I wear a lot of layers.
Okay. Ready.
What? I saw socks.
This is crazy. You would definitely get struck off for this. The patient is completely naked as House talks her through a lymph node exam, even though she's a doctor. And House pretends to be a pervert, which is great cover for him actually being a bit of a pervert. Most episodes we see House do something that he'll get struck off for, but in this one, he'd actually probably have to sign the sexual offenders register as well.
Fingers didn't go quite as deep. Feel that note again.
It's swollen.
So the sexy music changes to a dramatic music because, of course, within the craziness that's happening, it leads to a major breakthrough and they find an enlarged lymph node.
Looks like you're doing a biopsy.
Right, okay, so now they want to biopsy this lymph node. Why? Why do you want to do that? If you somehow manage to diagnose cancer or lymphoma or something else, there is nothing you can do about it in the South Pole. She'll have to wait for a definitive diagnosis and treatment when she comes back. So an unnecessary invasive procedure that she has to perform herself is going to put her in even more danger from the actual procedure itself, so the risk of bleeding or infection. In reality, they should just be treating the emergency situation and keep her safe until she can be evacuated, however long that may be. There is no value in knowing what that lymph node is in this situation.
Okay, I'm in.
You need to pull back on the syringe.
Well, they ain't taking my advice. If the lymph node had been like close to the skin on a limb, you might make a case for doing this weird biopsy, but blindly putting in a needle into a mass in your abdomen without ultrasound guidance is a terrible idea. You could easily miss it and end up perforating her bowel, making things 10 times worse. And as we said, even if you learn something about it, you still don't have any treatment. So you're risking a perforated bowel in a completely unreachable patient who also has a pneumothorax. Okay, it's just stressing me out a bit.
Wilson found signs of inflammation in your biopsy. That plus the 2 failing kidneys points to autoimmune disease, probably SLE or vasculitis. Treatment.
So House is suggesting it might be SLE or vasculitis. So SLE is lupus. So he's suggesting even something that he would never normally suggest, as per his catchphrase. I love how he doesn't actually call it lupus, so as not to alert the audience that he's actually considering it.
Autoimmune is just your latest theory. Like cancer before that and a kidney stone before.
Take the prednisone. You'll get better. That'll be your confirmation.
You practice medicine like it's a fire sale.
Yes, She is exactly right. This is a shit show.
Are you all right? Took the station mechanic 20 minutes to respond. She'd already slipped into a coma, started her on prednisone, but no improvement.
Wow. So now we have a reduced GCS. So there's something that's affecting the brain. What could this be? Well, we know she's got a pneumothorax, so it could be low oxygen or even high carbon dioxide. We need to think about blood flow to the brain. So is the heart and the vascular system okay? The brain is a very metabolic organ too, so we must consider low blood glucose or perhaps a toxin that's affecting the brain. And we also know she has kidney failure, so the kidneys might not be getting rid of waste products like they should do, so she might be developing uremic encephalopathy, so a brain dysfunction due to rising waste products within the blood. All of these things potential causes of reduced GCS.
Drink her urine. If it has a strong, concentrated taste, it means the problem's in her kidneys. Watery taste means it's her brain.
Sorry. What? From the sublime to the ridiculous. Instead of talking a highly trained engineer through how to take a blood test, which I think would be entirely possible, they are going to get him to taste her urine. I think House and Wilson here have just given up and just completely lost the plot and are just doing this to wind the guy up, sort of prank him.
How do we get the urine out of her?
We'll take a straight catheter and insert
Those
it.
are your only questions? Not.
Whoa, whoa, whoa. So the plan to taste the urine also involves him putting a urinary catheter in her urethra, yet the more reliable option of taking a blood test and getting him run the blood test is more difficult. It's like, how does that make any sense? Just talk him through the blood test. Yes, I know it's for the drama and the funness because it's fun to watch someone drink some urine on TV. I get it.
Milk, lemonade.
Bottoms up. See him having a nice little schooner of urine. I don't want to be that guy. I mean, I've been that guy the whole episode, but you can clearly see the urine is sort of a light straw coloured here. So we already know it's not concentrated before he drinks it. But he does it anyway because, you know, drama. I've been such a hater in this episode. I mean, I have really enjoyed it. Despite how mad it is, I'm enjoying the drama at the expense of losing my medical sanity.
You're gonna drill a hole in her skull. If she regains consciousness, it's increased intracranial pressure.
Word. So, without any real evidence, any kind of observations, any kind of additional examination or blood test, we are going to be drilling into a head. And why the hell not? It's a bit of fun, isn't it? I mean, there is the small issue that there is no real evidence for it and potentially cause a huge bleed and down the line a massive infection in a fairly unstable patient. But hey, let's give it a go. I mean, it goes without saying, it's crazy barbaric. And at this point, I feel like House is just like playing a computer game, you know, where you give up on a computer game and you just see how much abuse your character can take. I think we're at that stage.
The drill bit is sterile.
Place the drill bit against the upper left part of her forehead.
I really, really hope that before the drill bit touches the head, that House has some crazy revelation and figures it out, gives her some basic treatment, and she wakes up. Because having a hole in your head, a collapsed lung, renal failure, and being stuck on the South Pole for several weeks, it's probably going to finish her off regardless. Nope. Nope, we're drilling. We're drilling.
Sean? What's going on?
Hurrah! Miraculously, she's awake. Of course it worked. I was never in doubt.
Take off her socks. Your toe is broken.
Oh my God.
Bits of bone marrow have been leaking into your bloodstream. Those fat emboli have caused blockages in your kidney, lungs, and brain.
And there you go. So we have our diagnosis. And you know what? I don't hate it. Fat emboli from a broken toe. I mean, I was never going to get that. It does kind of make sense though. I like the fact that you didn't see her toes before when she was getting undressed during the examination because she was too cold. Very clever. I like that, and I should have seen that coming. And I'm going to put that in my medical practice now. Socks off. Of course, the diagnosis does require us to suspend a certain amount, or let's just say a hell of a lot of disbelief. Fat emboli can happen after broken bones. Typically, these are larger, long bone fractures, so less likely in your toes. And the way the emboli present in different parts of her body was not typically what you'd expect. In the kidneys, yeah, we could get pain and renal impairment, so that fits. A big swollen lymph node, not so much. Causing a tension pneumothorax in the lung, that is wild. Although no doubt it's happened somewhere. Never say never in medicine. And for a stroke to cause raised intracranial pressure, it's gonna have to be a big stroke with brain swelling developing over days. So she wouldn't just wake up feeling relatively normal after having a hole in her head. She'd have significant stroke symptoms. And fat emboli are really hard to treat. They're really hard to break down to restore blood flow through those blood vessels. So she is far from out the woods with her pneumothorax, her craniotomy, her renal failure, and with these fat emboli still in situ. Yeah, she's gonna have a tough job making it out there alive. And so there you have it. That must be the craziest house episode I've ever seen. Thank you so much for recommending this one. I can see why you wanted me to check it out. I loved the drama, and it had a little sprinkling of medical science in there too. And so please in the comments let me know any other episodes you want me to check out of House, and also any other TV shows too. Thank you again so much for watching and all your support on the channel. I hope you're all well, and I'll be back soon.